So
I need to change that. I'm sorry, it's disruptive. Let me change my settings. Okay.
you can't say you don't know that it's being recorded, right?
That's why, yeah.
Yeah. Okay, so before I came on here, I went into the Canvas course and started uploading some information. And this is information that all of you can use, whether you're dentistry or not. It has, one of the links is to something called explorehealthcareers.org. They have every health career in there. So make sure you open that up. Of course, there's information about dentistry, but there's a lot of other things in there. So there are links in there, and I started uploading some of the worksheets and materials, and everything up to week 1 is there. And then as we go through each week, I will upload some other stuff. So a little bit about me. Introduction, it's that I was the interim dean. I was the interim dean last year. I'm the senior associate dean right now at the dental school. And I have a dental degree. I'm actually from New York originally, and my dental degree is from Rutgers. So I have been in various environments and just loved it all. I've lived in the Midwest. I've lived several different places, but I've been here for 15 years at the dental school, and it's really been great. And you'll see why as you get to know the professional mentors from the dental school, because I absolutely love working with them. My presentation is actually going to start off with them, because that's what you're going to be when you go into your respective professional schools. And I want you to see what they do at school. Obviously, they study really hard and they take exams and they've got to learn their craft. I want you to see what's important to us also. And I heard the speaker before me talking about getting a person that's interested in extracurricular and other activities. And so I kind of want you to see what we do at the dental school relative to that. My other degree, I have a degree in informatics, so I'm a computer science specialist also. And so I do a lot of work with computer science. I design patient information systems and things like that. So two things that don't seem like they're related, but we make them work. So it just shows you how flexible some of these careers are. All right, so I'm going to share my screen. And I will turn off my video, so we'll be looking at the screen for the time being. Okay, can everybody see that? All right. If you have a question, please feel free to go ahead and put it in the chat, and I will try to catch it while I'm going. We can take questions at the end also, but if something just really comes to you while this is going on, please let me know. All right, so let me start off with some of our student groups. I told you I start with the students because I want you to kind of see what the experience is like, because this is not just what the students do, this is what we do as dentists. So we're out in the community doing a lot of work in the community to help people. These are two of our groups. I'll show you some more. The AAWD is the American Association of Women Dentists. And here are some of the things they do. They have a welcome night for D1s. We don't call them freshmen, sophomore, junior, senior. We call them D1s, D2s, D3s, and D4s. So there's a welcome night that they have for them. The pictures that you see there are their biggest event. That is a Cake Off for the Cure, and it benefits the UAB Comprehensive Cancer Center. And for that, the whole school, whoever feels like baking, will bake a cake, and there's a big competition for the best tasting cake and the best looking cake. And then we all pay $1 per slice to eat the cake, and that's how they make their money. And so they made about $5,000 last year doing that. They have wine and wisdom events once a month, so that's pretty exciting. They get people from the community to come in and talk about dentistry, so they like to do that. HDA is our Hispanic Dental Association. They also have an introductory meeting for the D1s. They have something called Salsa and Sangria. That's one of my favorite events because I don't drink the sangria, but the salsa part is really great. Lots of Spanish food, and it's really a great multicultural event, so I love that. They have a sloss fright night that they do all together as a group. And I think you may have had a tour of sloss. Did they have a tour of sloss already? So you had a tour of that. And so they actually go out there and they have a fright night, which is a lot of fun. They have a oral hygiene education event that they volunteer for. And then they have something called Dental Immersion Day, which is for high school students to teach them about dentistry. So lots of fun there. The Student National Dental Association, the 3 students that you are working with, they are all part of that organization. That's the organization that they principally work in. And they have done a lot of stuff. This is their canned food drive. And what you can't see here is this was actually a Christmas party. And what they did is they said, look, we're charging $10 for you to come to the Christmas party. The $10 is for the food and the alcohol. But if you bring a canned good, we take $5 off. So this is just some of the cans. They took this picture before everything came in because it was boxes and boxes afterward. So this was some of the cans in their canned good drive. They also participate in this Take Your Child to the Doctor Day. This is actually sponsored by the mayor of Birmingham's office. And it's to encourage people to take their child to the doctor. And this is our dentistry table. And so what they did here was they had screenings for kids. So you can see they have the little puppets and everything out. And so they did that with the pediatric dentistry residents. It was also a lot of fun. Lessons in a lunchbox. We do a lot of stuff for kids. This is one where we adopt a elementary school and we go into the elementary school and teach them about nutrition, dental hygiene, and brushing and flossing. And it's a lot of fun. So you can see the pictures there. They are taking pictures with some of the lunchbox you see there in the gold. And in the lunchbox are lined with the nutrition lesson. And then inside the lunchbox is toothbrush, toothpaste, floss, things like that. So another fun event. Some of you may have come to our Impressions event. And so that's an event actually for you. And there's Janai right there. This was her when she was you, right? So she was in college and she came to our Impressions event and we wooed her into applying and she got in and now she is your mentor. So I don't know if there's anybody else here that you'd recognize. This is an older picture, but I grabbed it because I remember when Janai came in. So this was Janai at the Impressions event. It's an all-day event on Saturday. They do a mini Kaplan course. They let you do some hands-on. We get to take impressions of each other. And then they teach you a little bit about the dentistry courses and what a day in the life of the dental student is like. So really fun event. And Janai can talk more about that because we had her there. This was an interesting event. So we had a Woman to Work brunch at the Art Museum. And this is where, so if for those of you who may or may not know about it, there is a group called Sisters in Dentistry. And it's actually a group for women of color in dentistry, and it's on Facebook. And so we had a Facebook meeting in Birmingham of all the women that were in our area. And so this was a picture of the women that were from or linked to UAB. This was not everybody that was there, but all of these people were either current students at UAB or they were UAB graduates. And so the event was a lot bigger. So that was a lot of fun to do something like that with a really big Facebook group. The Facebook group has, I don't know, about maybe 4,000 or 5,000 members. The D1 Wax and Relax. So this is an event that the students put on. The third and fourth years put this on to help the first years with their very first practical exam. So as you can imagine, some of you, if you're in the dental group, you're going to get the chance to carve a tooth. And as you can imagine, it seems scary when you first have to do that. So this event is to help prepare the students for their first exam, their waxing exam. So it's a fun thing to do, and it really takes the stress off. You can see they have a pizza fundraiser. They have some panel events. This is a pre-dental event that they had a couple of years ago with one of our pre-dental societies. So we work with them locally also on campus and in the Birmingham area. This is one that I'm really proud of, the Grace Thanksgiving meal. So the students decided that they wanted to do a thank you at Thanksgiving for all of the housekeeping and environmental service workers at UAB in the dental school. And so they took their money that they had from their various fundraisers and they bought them all a Thanksgiving dinner and then hosted them at the school. for a free lunch. It was actually a Thanksgiving lunch that they gave him. Thanksgiving dinner food, but it was at lunch. So that was a really nice thing to do. They read for children at the Children's Hospital, so another fun little event. And then the last one on here is the Operation Help and Hope. This is a big event put on by one of the mega churches in the area, the Worship Center Christian Church, and it's at the Boutwell Auditorium. This is a really big auditorium. And they have an event in there, and we have a dental station. So this is just some pictures from when we had the dental station there. And then, because of all of our work, I nominated the group to get an award. And so they have gotten the Presidential Award for a Student Diversity Group on campus. And so that's from the UAB president. And then up here, this is actually a national award. And this is because we had 3 national officers in the Student National Dental Association. We had a president, we had the communication specialist, and then we had the treasurer. And so this was us at the gala. There's me, and there are some other people here who, they've all now graduated, but they were some of the officers and people who come out to support them. All right, so I talked about our Impressions event, and please, ask about that if you are in the area and we're able to have it. We typically have it in February. We were gonna move it this year, but we may have to move it a little bit later if things open up to be able to have you. If you are in the area or even in driving distance, it would be worth it to be able to get the hands-on that we're missing from this event. So that would be a good thing to do. All right, so now on to dentistry, because this is part of what you wanted to hear about. So why are we doing dentistry? Well, I did not know this when I started doing dentistry, but as I found out, I said, well, this makes sense. So this is a web page, so I didn't make this up. US News reveals the 2020 best jobs. And obviously, if you're on here, again, here. Let me scroll through and show you because there's a bunch of careers here. So here's your best job. So out of the 100 best jobs, number 1 is software developer, and number 2 is dentist. And because I'm also a computer scientist, that must make me the happiest person in the world because I get to do both of these. But notice that number 4 is orthodontist, which is also a dental specialty. So we have 4 of the top 5 100 best jobs. And there's a reason for that. So best paying jobs, you have anesthesiologist, surgeon, oral and maxillofacial surgeon, and orthodontist are both dental specialties. So we are 2 of the top 5 best paying jobs. And then when you get to the best healthcare jobs, dentist is number 1, right? There's orthodontist. So dentist here is the general practice dentist. And then orthodontist as a specialist is number 3. Physician assistant. And so you will probably meet some physician assistants in the program, even though because health professions has some physician assistants programs there. And then number 5 is physician. So that's your medical doctor. So you're all in a good spot. If you go through the list, you'll see all of the careers that SHPEP actually has in their programming is listed here, but these are just the top 5. So I just thought it was interesting to see where we go, and I'm very proud of that. Okay. So that's one of the things that's great to see. So what are our options here? Dentist is the one that we're gonna spend most of the time talking about, but you can also go into dental hygiene. So those are the ones that primarily do the teeth cleaning, and they make a really good living too. Dental assistants, we have a dental assisting program here at the dental school, and then lab technicians. So those are the options. So the dentist is actually, we think of ourselves as physicians, but our practice is in the field of dentistry. So we concentrate on the mouth, the teeth, the gums, and the related areas. But the reason why we consider ourselves to be physicians is because it's not just about fixing teeth, it's looking at how the mouth, the teeth, the gums, all of the head and neck as a whole is for systemic health issues. So we can tell by looking in a patient's mouth what the status of their systemic health is. There are indicators that we can see to tell us that a person might be diabetic, that a person might have osteoporosis when we look at their dental x-rays. So there are lots of indicators that we have, and we have to pay attention to that and work with the person's physician, and sometimes the ophthalmologist and the optometrist on overall making sure that the patient's care is being handled appropriately. So our primary job is prevention, diagnosis, and treatment. We look at the diseases and injuries and malformations that all have to do with that head and neck area. Those are influenced by a number of factors. It could be something genetic. It could be discoveries between oral and systemic diseases like we talked about, salivary diagnostics, which you're gonna have a talk on that a little bit later, which you will enjoy, and that will show you some of the research that we also do in dentistry. This side of the way. All right, so here's something that we did at the School of Dentistry, and I wanted to show you this because I think it would be interesting to anybody if you've ever been a dental patient. If you have had a cavity before, you're interested in this. But this is a new technique that we developed here at the dental school where you could get a cavity filled without having a teeth on and without having filling. So these are the types of things that we do in terms of our research. I'll show you a little video of this.
The surface to receive the resin. This has
Dr. Robinson, can you share your sound on your video?
Oh, you can't hear the sound?
Not very
Sorry.
well.
Let's see. Sorry, I had to close it. I can hear it, you can't. All right, let me turn it up a little bit. Again. Is that better? Is that better?
here we can start drawing.
That's better.
Okay. So let me explain what he was doing. So instead of using a drill, he has an acid material that he's putting in between the teeth, and he's using the acid to dissolve the cavity material and to open up the space in the tooth for the filling. Then he is using the clear gel that he put in there. That's the filling material. And so he hasn't used a drill, and he hasn't used any traditional filling material. He's used this etchant material and this gel to kind of open up the cavity space and then fill it with the gel. So really groundbreaking. And if we can continue to develop that, that's going to be a great technique, especially for patients who don't like having their teeth drilled on. So just an example of some of the novel things that we were doing, that was all over the news. It was all over the local news. It was on the national news. The clip that I showed you was on ABC News, the national ABC News. So that was all over, and they got interviewed. We got a lot of press for it. So something that's exciting, I thought you'd like to see. So again, here are the things that we do. These are our areas of concern that we talked about. And so this is going to be our focal point, right? So the tongue, the floor of the mouth, the throat, the muscles. So there's a lot when we talk about the mouth. It's not just the teeth, it's all of these other things, including the nervous system and all the blood vessels. And our professional mentors can tell you, because they take gross anatomy, there's a lot involved in all these structures. They appreciate the fact that they're concentrating on the head and neck, and they love the fact that they get to use, you know, real human bodies to work on. We do some on real bodies, and then we also have anatomic, electronic structures that work on as well. All right, so prevention. So this is a picture from one of our elementary school programs showing how we actually go out to do prevention programs. And so when we're doing prevention, we educate people, and nutrition's a big part of that. At some point towards the end of this program, we will have a nutrition Jeopardy game. So I'm going to urge you all to learn as much as you can about nutrition, because there's usually a really nice prize associated with that we'll have to mail to you this year. But this is always the highlight of the program for us, is to have this big Jeopardy game. And it's a real battle among the students to see who's going to win. So that'll be fun. But learn your nutrition, because that's important to dentistry. And that's part of what we educate people on. We also educate them on home care, proper brushing, and proper flossing. And then when they come to the office, the big part that we play in prevention is to put sealants on and to have fluoride treatments done. And you can see here, this is a elementary school program, and they're using SpongeBob, because that's what those kids' aids relate to. Diagnosing. So that's preventing. We'll talk a little bit about diagnosing. So diagnosing involves two big pieces. One is listening to the patient and talk to people and figure out what's wrong and problem solve. That's the piece there. We call that treatment planning. When a patient comes in, we talk to them about their needs. Sometimes they're aesthetic, sometimes it's pain. And then we try to assess the history of the problem and figure out what's wrong. Then we look at the problem visually. We may take some x-rays, and you're going to see some dental x-rays as we go on in the weeks. And then we do a clinical exam, and you'll see a modified version of a clinical exam sheet, and you're going to get to do an exam on a family member at home, and we will show you how to do that. And you have the sheets in your packets that you'll be able to do that, and everybody will do that, because it's going to be a great exercise to learn how to look for dental anomalies. Everyone has a dentistry kit that has a dental mirror in it and a probe and an explorer, so you're going to get to do that, and I think that'll be a lot of fun, so you learn how to do these on yourself too. So we talked about the radiographs, and the radiographs, x-rays we use, most of our stuff is digital, and we use them. We get pictures of the teeth. We can get different types of images, and I'll show you what those looks like. So here's one this is called a Panorex, and this is going to get all the teeth. So you can see here, we can see this patient's all their upper teeth and all their lower teeth. And does anybody know what this white stuff is in here? You can put it in the chat or call it out. What is that? This person doesn't have that. This person has these white, what are these white things?
Cavity fillings.
Yes, thank you, Madison. Cavity fillings. So those are cavities. So this person has a lot of cavities. This person doesn't have any cavities, but this person has, what's going on here?
Wisdom teeth going in.
Wisdom teeth growing in. So you all are already x-ray specialists, right? So this person's wisdom teeth going in. They also have some other teeth coming in. You can see some teeth coming in over here. So this person's a little bit younger than this person. Now that's not to say you can't be older and not have cavities. I don't have any cavities. So cavities are not a natural part of aging. So here's some other x-rays. These are called periapicals because they only take about 2 to 3 teeth in each x-ray. So that's what these two are called. This one here is, this is a cone beam x-ray, and it's similar to a medical CAT scan because this one you can see in different slices. So when I get this x-ray, what I get is a sheet that has 50 slices of the same area. So right here, there is some kind of cyst that's here. And so I could look through each slice to see where the origin of this cyst is. And also it'll show me the patient's nerves and blood vessels and other structures. And I could see where they are in relation to the cyst if I was gonna go in and do surgery to remove that. So the dental diseases are going to affect hard and soft tissue. So the hard tissue is going to be like the enamel, the whites of the teeth and the bone. And the soft tissue is going to be the gum area, right? So we have both those areas that we're concerned about when we look at our most common dental disease. So at the top here, we have something actually called, this is a baby bottle decay. This was a baby who was drinking a sugary drink every night. And parent didn't know any better. That's what was done to them. So they did it with their baby. And this was the result of that, every night drinking sugary drink. So we educate the parent on what to do, and then we have to go in and fix this. This here is a soft tissue. So this is hard tissue disease. This is a soft tissue disease. And this is on the tongue, something called a thrush. And here's an example of some of the things that we look at. You may have had a canker sore before. That's something that's harmless, like a mouth sore. So a lot of people have had those. A lot of people have had fever blisters. And then hopefully none of you have gum disease, but a lot of older adults have gum disease. So we see a lot of that. So here's some other disorders. And this is these patients here. These are pictures of a patient with a cleft lip. So this is a congenital disease. It's a birth defect. And so we also take care of those as well. We have patients sometimes that have cancer, head and neck cancers, and we actually have specialists in oral and maxillofacial surgery. It's a subset.
Dr. Robinson, we lost your video. I mean, your screen share. Dr. Robinson.
I think she may
We may have lost Dr. Robinson altogether.
Y'all hang tight. She's been.
She'll rejoin if she'll know she's been lost. I agree with the conversation earlier about acid, the acid treatment for cavities instead of drills. Cringe worthy. She should be back in a moment. This is one of the drawbacks of Zoom. Oh, here she is. There we go. She's back in. Dr. Robinson, are you?
Yeah, I'm back.
There you are. Hello.
It just, all of a sudden it just cut off. So I thought, and what happened? So it was just me apparently. All right, I will go back to my screen and see where we were here. Oh, the joys of Zoom. Okay, so I think we're back now. All right, so this is where I was, and I was talking about the birth defect here, which is the cleft lip and palate, and how we have dentists that treat that, and we have some dentists in oral and maxillofacial surgery that treat head and neck cancers as well. All right, so treatment. That's what we do. If you like to solve problems and you like to see the result of your problem solving, this is the career for you, because we get to fix what's broken. That's what a filling is, right? If you've had orthodontics, any of you that have had braces and it was successful, you've seen your teeth be repositioned. We do root canals, we do crowns and bridges, all kinds of things to fix problems. So we fix what's broken. We also replace what can't be fixed, right? So an implant, for example, is to replace a missing tooth. So we can't bring that back, but we can put an implant in. We have dentures, tooth whitening, so all kinds of things that we can do to either fix or replace missing teeth. We also restore missing tooth structure. And more importantly, it's not just about the aesthetics and the way the patient looks, we also restore function. So somebody who's missing teeth, their problem is not just the way they look, but they can't chew. Imagine trying to bite into an apple and you don't have any front teeth. You know, how would that work? So restoring function is important. Function is important for eating and for speaking and for your face to have the correct fullness. All right, so here's some before and after so you can see. So the top here is the before. So this is a patient that had all of these teeth here that were broken down from decay. That's the before, and you can see they have some dental work already done on this side. And then here's the after, where we replaced all of that. Look at that, it doesn't even look like the same person, right? So all of these were taken out and redone. And these were done with composite resins. And this is a overdenture prosthesis that was put in here to anchor these teeth. This is another one, okay? And this patient has a problem. Their bite is also collapsed, so their teeth are not lining up properly from all the broken down teeth in the caries. And here is this person with their finished bite. Same thing here. Looks like this is mostly stubs here on the lower teeth, and here is the replacement. So this took months to get this done, but it just looks remarkable. And I picked these on purpose because this person thought that there was no way this could even be fixed. Right? So it's remarkable, really, what you can do. All right, so I'm going to talk a little bit about the dental specialties, because some of you probably been to some of these specialties, and if you haven't, just so you can start thinking about what we all do. So prosthodontics has to do with replacement, right? So they are the ones that replace teeth. They primarily do crown, bridges, and dentures. General dentists do those also. General dentists can do any of these things, but the specialists, they are specializing in doing more of the complex cases. So here's an example of what they do. Here's 3 teeth here. This one's missing, right? So what does the prosthodontist do to replace this? They could do a bridge, which is one option. And to do a bridge, they cut down this tooth, they cut down this tooth, and then they these two create an anchor for the missing tooth in the middle, which is called a pontic. So here it is when it's completed. This is the crown for this tooth. This is the crown for this tooth, and this is the pontic for the missing space. This gets cemented onto here, and this is what it looks like when it's finished. This is a partial denture, another prosthesis that a prosthodontics will make. And so they restore structure of teeth and hard and soft tissues, and they restore function, and then of course aesthetics. Those are their big areas. This is what's called a maxillofacial prosthodontist. I bet you a lot of people don't know about this one. This patient had cancer, and he came in with his nose missing, and he came to the dentist, and you're probably wondering why. Well, the dentist worked with his oncologist and his facial reconstruction surgeon to actually make this prosthetic nose. This is a specialty that a person would do an additional year after being a prosthodontist, and they would learn how to make these prostheses. So that's what was done here, and it's actually quite impressive. This patient here was missing his ear. And again, this is a maxillofacial prosthodontist that did this. This picture was from the maxillofacial prosthodontist at our school, and he replaced this patient's ear. This patient actually had trauma, and that's why his ear had to be removed. Okay, and I see that there's some questions on the chat that Anna and Nia are answering, so great. Let's see, there was a question about the veneers. And veneers can be done by any dentist, but veneers are actually one of the staples of a prosthodontist as well. So with the veneers, what happens is that the fronts of the teeth are shaved down and they're replaced with new fronts. So that's a good question. And veneers do fall into that category of what they might do. Now I've moved on to periodontics. And periodontists, they look at gum disease. So if you look here at my stages of gum disease, you have, this is the healthy gums, right? And so you have, here's your tooth, this is your pink gums, and then this is the bone underneath, right? This is when you have calculus or tartar. Calculus, plaque, tartar, it tends to gather right around this area of the tooth. The next to the tooth is where it will gather, right? After you don't brush that away and it starts to build up, the bacteria from the calculus and the tartar start to eat away at this gum tissue, and it makes what's called a pocket. As you can see now, it starts to open. This is supposed to be tight, but now it's not. There's a pocket. And what do you think happens when you have a pocket? Well, things can get in there, right? So this is when it gets advanced. The pocket gets even bigger. So now for sure something is going to get in there. And this is what this looks like on a person's actual teeth, right? So this is, you can see some bleeding. The teeth are, the gums are a little puffy and a little bit more red than normal. So periodontists, they deal with replacing or fixing problems having to do with the gums. And to do that, they can do what's called a graft. And in a graft, they may say, here's a picture here. So this patient here, I'll show you how a graft works. This patient here is missing some gum tissue. What they did is they took gum tissue from the palate where there was some extra gum tissue, and they implanted it in the space and stitched it on here, and they used grafting material to help it stay. And when it's successful, it actually grows onto the existing gum tissue. And now look, we've repaired that. So that's one of the things that they do that's actually really great. They also place implants, and there's a lot of different surgeries that they do having to do with implant placement as well. Endodontics, endo means inside. So everything here happens inside the tooth. So what you're looking at here in this picture is that if I opened up your tooth, like cut it open with a drill, and I kept drilling and drilling and drilling all the way down to where the nerve tissue is, that's what you're looking at. When somebody has to get a root canal, it's because this nerve tissue here is damaged. There's a question here, is it painful to get a gum graft? It would be painful, but they are given local anesthetics, and some people also choose to get some additional anesthetics where they could be a little bit drowsy. So we will give local anesthesia. We don't generally put people to sleep, but we can sedate them. And when someone is sedated plus a local anesthesia, they really don't feel anything at all. Here's the root canal picture. So when somebody's getting a root canal, usually it starts with a toothache, and the dentist looks at the tooth, and their first thing is, hopefully I can fix this by giving you a filling. Well, if the damage and the bacteria have gotten so far into the tooth that it's damaged the nerve, then a lot of times they can't give you a filling anymore, and you have to get a root canal. And the reason for that is that the nerve tissue is damaged, and that has to be removed. That's what you're looking at here. So here's what happened is all of this nerve tissue here is removed, and it's filled in with this inert material to fill in the space, just to make sure that you have to put something in the space. So this is a material called gutta percha that we put into the space to fill it up, and then we'll put another filling or a crown on top of it. And that usually will solve the problem for the person. So if you think about the way disease progresses in dentistry, it will start off sometimes with a toothache that could be something small. If it's a really small cavity, we might not even have to drill it. We might be able to give you something to rebuild the tooth structure around it. As it gets bigger, now you're going to need a filling. And if it gets bigger than that, now you're going to need a root canal. So that's how that works. Sometimes when a tooth is kind of on the border, we will try to do a filling, and then we'll find out, oh no, this has got to be a root canal. And the patients get really upset, but it's a lot of times not the dentist's fault. It's just you can't always make it into a filling. If you get to the point where you're damaging this nerve tissue, then you've got to do a root canal. And that's what the endodontist does. Oral surgery as a specialty, they're known to be the ones that take out wisdom teeth. And that's part of what they do, but they do a lot of other things as well. So extraction is one thing, and impacted the molars, those are the wisdom teeth, and that's what someone correctly diagnosed earlier. This wisdom tooth here, though, if you look at the x-ray, has a little cyst around it, right? So they have to take this out, they have to take this out, and they're gonna have to remove this cyst before it starts damaging these teeth here. They also will take care of infections. So there are facial infections that they deal with. They deal with cancer, as I talked about, and trauma. Trauma is probably their biggest thing. I am a general dentist, but I did a 1-year residency, and I was on call. And of course, I'm in New York City where a lot of stuff happens. My first night on call, I get called to the emergency room, and it's a patient who got shot in the face, and their jaw was completely fractured in a million different pieces. And so I had to call the oral surgeon, and it was fascinating to get to work with them because everything was just completely open up. There were teeth everywhere. And what we got to do was we had to splint the person's jaw back together using metal brackets. And then the person had their both jaws closed together, and they had to stay like that for 8 weeks and drink through a straw. So they lost a lot of weight. But eventually it was healed, and it was a good outcome for them. But it was just amazing to see something like that. I have a question. When do you have to pick a specialty? And you know, there is no specific time. I just wrote a recommendation letter for somebody who wants to go into endodontics, and she graduated in 2009. So you can pick any time. I do think that it's easier to get in the first 3 years after you get out. And most students that are applying directly from dental school, if you're gonna apply directly from dental school, you have to make the decision by your 3rd year, because that's when all the application cycles start. And so we try to give you a broad band of experience so that you have enough information to make that decision. And if you're interviewing at dental schools, that's a good question to ask them, is how much exposure am I gonna get to the specialties so that I can make a decision by my 3rd or 4th year when I'm going to be applying. Oral surgery ever overlap with the maxillofacial specialty? The maxillofacial and oral surgery, you're very wise, work together all the time on cases. The oral surgeon who does cancer and trauma as a subspecialty. So we have some oral surgeons that have extra schooling beyond that to do this. And they will actually work with the oral and maxillofacial prosthodontists as well. So they always work together. And we actually have now a faculty member who is 50-50. He works half in each area. So they work together a lot. And on their team also will be some medical doctors as well. So like I said, all of the specialties tend to work together when you have patients, especially ones that have trauma and cancer. You'll see more teams working together. All right, so orthodontics, a lot of you have braces, so you know what they do. And this is one of the popular specialties, but is one of the most difficult to get in. So I have a student now who has tried 3 years in a row. And so this afternoon, I have a call with her to kind of talk about like, okay, let's just not send the same stuff in, just revamping it and sending it. We've got to do something different. This is a really, really tough specialty to get into. If you want to get into this one, your grades, you'll have to be at the top of the class to get into this one. So just something to think about if you want orthodontics, the grades are key. Was there a question? Okay. Pedodontics, children's dentistry. This is a really popular one with our school especially. Of course, in this, for us, pediatric dentistry is from baby. And we see people even before their teeth come out. A lot of them, they come in with their first 4 teeth, the 4 central incisors, and people will start bringing them in right away. And then we basically stop seeing them at 18. A lot of people stop around 14, 15 when they have all of their adult teeth and their wisdom teeth are starting to come in. Some people love their pediatric dentist so much they'll go for as long as possible, and we cut them off pretty much at 18 or 19 is when we say, no, you can't come here anymore. But we also see special needs patients in the pediatric dentistry. So that's another big part of what they learn as a specialty is how to see these special needs patients. This picture's here at the bottom. This patient has not just a filling to fill this area here, but there's also sealant. So this little clear plastic coating is a sealant which protects the tooth from getting a cavity. Some of you may have that. Other specialty areas we have are radiology, oral pathology, and public health. We will have next week a faculty member come in who is going to talk to you about oral pathology and radiology, and that is going to be a great lecture, and it's going to really cover, it's really a medicine-focused lecture, so I think all of you will definitely enjoy that, and the way he does it is very entertaining, so you'll enjoy that. So how do you become a dentist? So just want to touch a little bit about the background and the schooling that's required. Obviously, high school, you've all done that, and this is where you are now. I put the question mark next to 4 years because I did 3 years of college. for college, you have to just take the prerequisites. You don't have to go for 4 years, but you have to take the prerequisite. So I did 3 years. I did get my degree in 3 years, but the big thing was taking the prerequisites. It can be any major. Again, as long as you have the prerequisites, the major does not matter as much anymore. It used to, but not that much. Then you go to dental school. So our D1 and D2 years, the dental mentors will talk to you a lot about that, but this is where you have the integrated basic sciences, but we also have some preclinical courses. This is our lab where we would have loved to have you, but we're gonna have you do some stuff at home that will be fun as well. So for those of you that have that Irish Spring soap, or if you don't have it, it's coming, and you're gonna do something real fun with that. So don't bathe with the soap. The soap is not for bathing. If you have the Irish Spring soap, please hold on to that. D3 and D4 is where they start seeing patients. So they will go on rotations. They have rotations outside the school into clinical dentistry, community dentistry areas, and then they have rotations inside the school where they get to see all the specialties. They have their own set of patients that they provide treatment for. So it's like they have their own patient list. And then graduation. So here I am with some of my daughters. I call them my daughters. They're not really, but I adopt them when they come to the dental school, and this is a really great time for us. So what are your career opportunities in dentistry? General dentistry is the most common. You have your degree, and then you just get a license by that state, and you can pretty much do anything, right? If you don't want to go back to school, but you want to do a little bit more of something, there are continuing education courses that you can take, and you can still focus your practice on that area. Cosmetic dentistry is an example of that. We have a lot of cosmetic dentists. They didn't go back to school. They took a lot of continuing education courses while they were practicing. So you can do that. If you're going to go for a specialty, it's going to be anywhere from 2 to 6 years. 6 years is the ones at 6 years is primarily oral surgery. Oral surgery has 4 and 6 year programs. Most of these are 2 or 3 years each. So depending on which one you want to do. And why do you do that? A ton of personal satisfaction. I would have to agree with the US News and World Report. There's a lot of satisfaction helping others. You saw some things that the students are doing. And as a faculty member, I do a lot of those things with them because that's what I like doing. I like the one-on-one relationship with patients. I like the advancing science, like what we're doing with the drillless fillings. And then I love the creative and artistic elements. I'm not good at drawing. I'm not good at sculpting, but I like doing things with my hands. And I have to practice a lot to make my teeth endeavors look good, but I just love that satisfaction when it's done. There's a lot of prestige, obviously, in the community, and there are financial rewards. And for people that want to have their own business, a lot of students finish and just open up their own practice. So we see that all the time. It's costly. And so you have tuition, books, you have fees and living expenses. We are a state school, so we're going to be far less than a lot of the other schools. So if you're looking to save money, look towards your state schools. And then if you don't win the lottery, there's an ADIA official guide to dental schools that will help you with how much each dental school costs, and places where you can get scholarships and loans. A lot of our students also do military service where they get money in exchange for some military services. And then there are some loan repayments that you can do in certain states if you work in areas where there's an access to care issue. So your career options look like private practice, academics, which is what I'm doing, informatics, that's what I do also. And I don't have to do that in a dental school, so that's why I listed that separately. I can actually work in other venues because of the informatics. You've got military service, institutional service, and then of course, research. And we'll have a researcher come on, I think the last week, to talk to you. This is what the private practice options look like. We don't get a ton of solo practitioners anymore. Most of the students go in with each other or with an older person, and they do more of a group practice. You also have a corporate. So a lot of people will just work for a corporate entity that owns a practice, and they get the feeling of owning it, but they don't have to all the headache of, you know, the overhead and all of that other kind of stuff. Let's see, with UAB being a public school, this is a chat question about how many out-of-state students does the UAB accept. So if you're out of state and you want to apply, I would encourage you to do that. That's a good question. Some in-state schools and public schools do not accept out of state, or they severely restrict it. We are very open. The class is about 60-40, 65-35. So I would encourage you to apply. If we want you and you want us, we'll take you. So we don't really restrict it to just in-state. The majority, the predominant number is for in-state, but we have a lot of out-state. And then I see somebody else. I have a question. Do you want to unmute yourself and ask your question? Because I'm at the end anyway.
I can unmute myself. So I'm still confused about the difference between a generalist and a specialist. So like, what is the generalist scope of practice really? So like, are they like, yeah, that was my question.
Okay. So that's a good question. So the general scope of practice is that really has to do with this can do anything that the specialist can do, but they're doing the less complex cases. So I'll give you an example with orthodontics. If a patient came in and they had one tooth that was out of alignment, let's say this tooth right here was out of alignment, a general dentist might be comfortable putting on braces to line up the one tooth. If somebody comes in and they have 8 teeth out of alignment, that's a lot more complex case. And so that would probably go to an orthodontist. But there are general dentists that, again, I mentioned going to take continuing education courses and learning how to do more complex things. So there's not a real defining line in terms of legally what you can do. Legally, you can pretty much do anything. But the complexity is where you start to go, this looks too hard. The other thing as a general dentist is that it's great to have a network of specialists that refer to you and you refer to them. So having that network is valuable. So don't take on things that you can't do. So as a generalist, I wouldn't take a case and go, well, I want to keep the money, so I'm going to do this. If it's complex and I know it's outside of what I normally do, I'm going to refer that out and build my network of my referral network. So I have people that I'm referring to. Does that answer your question?
Yes, thank you.
All right. So this is us in academics, and again, that's what I do. Here's, that might be an older picture, so nobody's in that one. So those are your career opportunities, and like I said, that was my last slide. We have a few minutes for other questions, if anybody else has a question. Let's see. What does it take to be a competitive applicant, like as far as stats go? Okay, so I heard the end of the last speaker, and like I said, I agree with her totally. We're looking for a whole student, but we have to make sure that you can get through the academics. So in terms of stats, that means the GPA, we're looking for something in the mid to high 3s, because that tells us that you can handle the work. The DAT, we're looking for something 19. 19 is the average across all dental schools. And so average means that there might be some higher, there might be some lower, but that's kind of the magic number for most dental schools is around 19. Typically, we get more excited if we see 20, 21, but 19 is kind of, that's what we're looking for. Now that said, the whole person piece comes in, because what if you've been a leader, you're the leader of your pre-dental society, you're doing a ton of work in your community or in your church, and your GPA is a 3.2, which is not mid 3s, and your DAT is an 18. Well, that looks very good. So again, it's the whole process. While you're in SHPEP, take advantage of some of the tools like the writing tools to show you how to write your personal statements, because we're going to read that and it's going to tell us a lot about you and the way that you speak and you write. We're going to look at that through what you've submitted. Interviewing skills. So look at all of those things because we look at everything. Has COVID-19 affected any admission requirements? It has not affected the requirements, it's affected the process. So we are looking now at doing all online interviews. And the part of that bothers me is I don't think everybody comes off the same way via Zoom. I think it probably helps a lot of people to be able to have that in-person contact, but it's just not going to be possible. So the requirements aren't changing, but the process is changing. And so it's going to be interesting to see when we sit down to talk about applicants and we've only had this digital interchange, you know, what applicants look like after that. What part of the application process holds the most weight when considering admission into the dental school? Okay, so before you get an interview, that's where the stats come in. So first thing is, do you have the numbers? So the stats are first, right? Then we have the letters. So if the stats are, so if you have below a 2, I don't think it goes any further. I'm just going to tell you honestly. So it's kind of like a funnel, right? And so if the first layer is the stats. So once you get past the stats, then we have the letters of recommendation, your personal statement that you've written, and we'll look at that and we'll say, okay, stats are good. This is really good. Let's call the person in for an interview, right? And so that's how it works. So I guess you could look at the stats as the gatekeeper, right? And then once you get in the gate, right, now you want to do well on the interview. And we have a lot of people. For us, I would say probably about 60%, it's gone after the interview, and that's because the interview doesn't go well. So take advantage again of the interviewing skills that we show you here, because then we lose a bunch of people to the interview process. So it's not really what's more important. It's really, like I said, a funnel, and it starts out here and we just start narrowing down. Do many dental students attend specialty programs at UAB after graduation, or do they go somewhere else? I have a UAB student in every specialty program almost every year. Not every year, but almost every year. This year, we have one in every program. There's a program that has 2. So I think they always apply. I don't know that they always get accepted, but we always have applicants from the DMD program who want to go to a specialty at UAB. And we always have applicants into every program. And we have every specialty except we don't have a pathology or radiology program.
Dr. Robinson, can I interrupt for a moment? We're almost at 12:30. And I was hoping to maybe give a few minutes of a break. There's lots of questions coming in. Would it be possible if I share the chat with you so that we can address those in Canvas, or we can reconvene at a later time? But there's lots of good questions.
Yeah, I see them
coming in.
That'll be fine. Yeah, because it is 12:27, and I know you all have something else. Let me just say thank you all so much for your interest. This is hard doing it this way, and I promise to get to your questions. And if the chat shared with me, what I'm also willing to do is to have another Zoom so we can talk one-on-one. I have the names of the people who are asking the questions. And so I will meet with your professional mentor and see if there's a time when you all just want to do your own private Zoom and we can actually have a, back and forth with the questions. I'd be very amenable to doing that as well. But thank you all so much.
Thank you, Dr. Robinson. So everyone, we're going to end this Zoom session and we're going to join the new session for Dr. Young's medicine session. So thank you all for joining, and we'll reconvene and take a 5-minute break and we'll reconvene. Again, thanks, Dr. Robinson.
Bye.
Bye-bye, everyone. See you in a second.